name's Gaucher. I'm a general cardiologist with special interest in pacemaker implantation. I've been putting in pacemakers for about 20 years now. Pacemaker's an implantable device. It's placed underneath the skin in the chest wall. It's connected to leads or wires that are inserted through a vein to the interior of the heart chambers, connected to the pacemaker, and will listen for the heart's own electrical activity and provide stimulation to have the heart contract if there's no detected activity. There are several diseases or disorders of the electrical conduction system of the heart that might lead to the need for a pacemaker. These may be quite serious and life-threatening and recognized as an emergency, or maybe much more subtle. Generally, pacemaker need is determined by patient's symptoms. These may be syncope or passing out, fainting, or coming close to that, or even general fatigue and lassitude and that sort of thing. The procedure is a very routine, minor surgical procedure. It's done using local anesthetic and conscious sedation. So typically these are scheduled outpatient procedures, although there are emergency procedures. But typically the need would be recognized, be electively scheduled as an outpatient. Procedure takes about an hour. So like I said, the patient would be sedated after being prepped and draped for a sterile procedure. Typically, the patient would spend the night, one night after the procedure. It's generally painless or minor discomfort associated with the procedure. Well, if the patient is symptomatic before having it, then it should be better if the pacemaker relieves those particular symptoms. There's a week or so of allowing the site to heal where activity is restricted, but after that there's very few restrictions. Most common one would be the inability to have an MRI scan. So we have a pacemaker follow-up clinic. It's a well-oiled machine. There are regular intervals where the pacemaker will be checked. The pacemaker parameters can be fine-tuned externally using a computer and adjusted to the patient to optimize the function for the patient. The GHS system has many talented, experienced pacemaker implanters. In addition to that, there's a dedicated team of specialists, nurses, X-ray technicians, pacemaker technicians that do this procedure on a daily basis. So it's a very well-oiled machine.